Persistent communicable diseases in Texas, past, present, and future strategies. In this presentation, we explore the ongoing communicable disease challenges in Texas that are persistently present here for the last few years. We also identify key threats and discuss proactive management strategies. Our goal is to build healthier communities. Historical overview: endemic diseases in Texas. Texas has faced consistent battles with endemic communicable diseases. West Nile virus, influenza, and sexually transmitted infections, STIs, have posed enduring threats. Understanding past outbreaks informs future preparedness. Endemic threats in the 2000s, West Nile virus, seasonal influenza, and STIs have been persistent concerns. The West Nile virus in 2004, Dallas County reported the first human case, marking a significant milestone. In 2019, a record flu outbreak, over 2 million cases statewide, highlighted the need for robust flu management. 2022 saw rising STI rates. Texas Health Department data revealed a 15% increase in cases. Endemic diseases, prevalence and impact. Human immunodeficiency virus, HIV, tuberculosis, hepatitis C, and vector-borne diseases remain prevalent. Vector-borne diseases are diseases where microbial pathogens are transmitted to humans and animals by another organism, most often the bite of an insect. The impact of key diseases like HIV, tuberculosis, hepatitis C, and vector-borne diseases like West Nile and Zika viruses necessitate ongoing vigilance and targeted interventions. HIV. Over 110,000 Texans live with HIV. Continued prevention and treatment are crucial. Hepatitis C has a 3.5% prevalence rate. It is often linked to intravenous drug use. It requires comprehensive harm reduction. Tuberculosis cases average approximately 1,000 cases annually, with urban areas facing unique challenges. Vector-borne diseases like West Nile and Zika increase and move northward with climate warming, requiring enhanced insect control. Socioeconomic disparities exacerbate disease transmission. Poverty, limited healthcare access, and education gaps undermine prevention. These factors require targeted interventions. Poverty increases overcrowding, which in turn intensifies TB and flu spread. Stable housing reduces transmission. Uninsured communities have 25% lower vaccination rates. Addressing cost barriers to vaccination is vital. Rural communities face limited access to healthcare resources. Expanding access is critical for prevention. Health literacy gaps in underserved communities impede prevention efforts. Educational campaigns empower communities. Current management strategies, strengths, and weaknesses. Texas employs various strategies to manage communicable diseases. Vaccination programs and surveillance systems are key. However, challenges in reach and reporting persist. Vaccination programs. Effectiveness varies, with flu vaccines at 40 to 60%. Increased coverage remains a goal. Surveillance systems. Underreporting in rural areas hinders accurate data. Improving infrastructure is crucial. Public health campaigns. Limited reach in marginalized communities. Tailored approaches are necessary. Dallas County's Fight the Flu campaign reached approximately 500,000 individuals, but broader impact is needed. Future threats. Emerging diseases. New infectious diseases pose significant future threats. Chikungunya and dengue are on the rise due to environmental shifts. Candida auris presents a concerning fungal infection. New COVID-19 variants demand constant adaptation. Chikungunya and dengue are increasing risks due to a warming climate. Mosquito control is vital. Candida auris is an emerging fungal infection with a high mortality rate of 30 to 60%. Strict infection control is essential. COVID-19 variants require continuous monitoring and rapid adaptation of public health measures. Future strategies. Proactive disease management. Proactive strategies will bolster Texas's disease management. Enhanced surveillance, community engagement, and telehealth expansion are vital. Significant investment is needed for a healthier future. Enhanced surveillance, real-time data and predictive modeling will improve outbreak response. Community engagement, targeted interventions delivered by trusted community leaders will increase effectiveness. Telehealth expansion, a projected 30% improvement in rural healthcare access bridges critical gaps. A pilot program in El Paso reduced TB transmission by 20%, demonstrating success. An annual investment of $50 million plus is projected to sustain these efforts. Conclusion. Achieving a healthier Texas requires collaborative efforts. Investing in prevention and preparedness builds resilient communities. Our collective future depends on these commitments. Collaborative efforts. Partnerships between agencies, communities, and individuals are essential. Investing in prevention. Proactive measures are more effective and cost-efficient than reactive responses. Strong public health infrastructure protects all Texans from future threats.